We can't disclose the details of what we've done, but believe me, we've got something that's good and I think is very, for us, it moves this bill way down the road.
Harry Reid last night in the Senate announcing a deal with absolutely no specifics.
None at all. He walked away when he was being asked about it, but I will tell you this, they are more confident, Senate Democrats, they can get this done than at any time during this process. Top line begins right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Jonathan Karl.
Sitting in for our under-the-weather colleague Rick Klein today. We are here every day bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics. John Karl, kick us off today. What is your top line?
Well, deal or no deal. Harry Reid says he's got one that can get him through this public option problem and get health care passed possibly this year out of the Senate. And he's saying he can actually get something on the president's desk by the end of the year.
Bizarre thing happening today. You hear Howard Dean giving some encouraging words here, providing cover for liberals. You hear Joe Lieberman saying he thinks this is possibly encouraging this sort of scrapping of the public option and trying to lower the Medicare age where you can buy into Medicare. Is your sense that Republicans may start joining this as well, or is this still fully a Democratic process?
Well, you know, possibly Olympia Snowe, although she's expressed some concerns about the Medicare expansion. Maybe Susan Collins. Nobody beyond that, but it's looking like Harry Reid, a week ago, it looked like he didn't know what he was doing. Now he's master of the Senate. We'll see where it's going.
Of course, we know none of the details fully, really. But Martha's Moment is our second top line. Martha Coakley, the Attorney General for the state of Massachusetts, is now likely headed to the United States Senate to be the first female senator to represent the Bay State. She trounced her competition in the Democratic primary up there for what they call in Massachusetts the Kennedy seat. She got about 47% of the vote, 20 points ahead of her closest competitor. And now, you know, it's pretty much a formality for that January special election, Jonathan, but she could have this seat for life, potentially.
Yeah, and, you know, the interesting thing here is, depending on where we go on health care, her first vote as a United States Senator could be final passage on a health care bill. All right, next up, plummeting polls. You heard Robert Gibbs, the White House press secretary, hammer Gallup yesterday, comparing their polls to a 6-year-old kid drawing with crayons. But now, David, you have another poll out by Quinnipiac that shows the president's approval rating at 46%. So you can't just beat up on Gallup.
No, that's the lowest they've scored it in, obviously. We've seen this. There was a slight bump after the Afghanistan speech. We're now seeing sort of a return down to a very divided country right now on Obama's approval. We'll get into that a bit later. And finally, Peace Prize. Yes, well, if President Obama can emerge from the cabinet room after his bicameral, bipartisan congressional leadership meeting today, and they have full buy-in from both parties on health care and the next jobs bill, then my God, he deserves the Peace Prize. But assuming that's not going to happen, they're going to have to thread a needle here as he gets on a plane to Oslo and sort of explains his acceptance of the Peace Prize as he's escalating a war and has not yet really accomplished much.
And show some real humility as he's about to be a Nobel laureate. It's going to be an interesting speech.
Which is not always the easiest thing for this president. We're going to begin up on Capitol Hill with Congresswoman Michelle Bachmann. She's a Republican in Minnesota. She joins us up there. Thank you so much, Congresswoman, for being here. I'd like to begin with health care, if I may. To get your sense, this has dramatically shifted. All these months, Democrats have been pushing this public option. You guys on your side of the aisle totally opposed to that. Well, it looks like it's gone now. Now they're buying into this idea of using the federal employee health benefit plan, allowing folks to cross state lines that way. Is that a health care solution that you can support?
You know, the healthcare solution that we can support, David and John, is one that's very simple, one that the American people like. It's the government not owning your health care, your employer not owning your health care, the average American owning their own health care. With tax-free money that you set aside, anything above and beyond that, write off on your income tax return. Erase these artificial boundaries between states so people can buy any health insurance plan from anyone in any state in any amount. Have true lawsuit abuse reform. We're done. And then for people who truly, through no fault of their own, can't purchase health care, we offer them credits or vouchers so they can purchase it out in the private market. That would dramatically cut costs for everyone that has insurance today, more accessibility, and it doesn't create a bureaucracy. That's the way to go. But unfortunately, this is a White House that has its fingers in its ears, the same with the Democrat-controlled Congress. They don't care what we have to say. They've never been interested in Republican input into this bill, and we've got a very good common sense plan that will actually work.
Congresswoman, if I can just ask you specifically about this deal that was hatched last night, the idea of
the trust me deal.
Well, the trust me deal, but we know one aspect of this, and that is the idea of setting up a system that is very much like the healthcare system that members of Congress and other federal employees have access to. It's private insurance companies, nonprofit insurance programs that would be negotiated by the Office of Personnel Management. That's the healthcare system you have access to. What's wrong with that?
Well, we have nonprofit health care in the state of Minnesota too, and it did not bring down the costs of health care. But again, you have to understand what's behind all of this. It's government, massive government subsidies of health care. Plus, it is the federal government having control over every insurance policy in the United States. There's a big difference, and at the end of the day, that's what everyone has to ask themselves. Will the American people as individuals have more control over their health insurance, or will they have less? Clearly, it's less, because all of the power moves over into an unelected health care czar. It's less about the people and everything about government
Congresswoman,
bureaucracy.
very quickly on the Medicare portion of this and expanding the Medicare. You guys have been going after the Democrats for cutting Medicare as part of their health care plan. Well, now they're reversing course and they're actually trying to expand it. Is that okay with you?
Well, remember, President Obama's own economic advisor, Christine Romer, said if this bill goes through, we will lose 5.5 million more jobs. That won't help anyone if we lose 5.5 million more jobs. We have to count the cost before we have the bureaucracy explode. This is bureaucracy on steroids, and this won't help anyone.
Congressman, I want to ask you about the rally you had several weeks ago after the House was getting ready to vote on health care. And I want to play for you something. One of your featured guests was actor Jon Voight, and he had this to say.
His only success in his one-year term as president is taking America apart, piece by piece. Could it be he has had 20 years of subconscious programming by Reverend Wright to damn America?
Now, that's Jon Voight talking about the President of the United States. Now, and I'm just wondering, because that was very much the tone of a lot of the speakers at your rally, is that something you agree with, or is that going over the line to say that the only thing that this president has done is taken America apart piece by piece?
Well, I like Jon Voight. I think he's a great American. And the 20,000 plus Americans who spontaneously gathered were there for one reason and one reason only. And it was to say, we want to make the decisions about our health care. We don't want government to take over.
Okay, but was that over the top, though? Was that over the top?
What you've got to consider is that just in the months that President Obama has been in office, 30% of the private economy has already been taken over by the federal government. Just in these few months, by taking over banks, AIG, the mortgage companies, Chrysler, GM, 30%. Right. If President Obama takes over health care, that's another 18% or 48% of the economy. Barney Frank has a bill this week that would have government taking over another 10 to 15% of the economy with the financial services industry. Think of this. This is stunning. This isn't just in our lifetime.
So you don't think Jon Voight was over the line, right?
Just in this year, government is taking over about 65% of the economy. That's not America. We need to look at what Washington is doing. That's why the approval ratings for the president and for the Democrat Congress are plunging so dramatically.
Congresswoman Michelle Bachmann,
don't want this.
We know you have a vote to get to. We will let you get to it. Thank you for being here. Come back again soon.
Thanks. Enjoy it. Thanks, David. Bye, John.